Hello everyone, my name is Mary Carlo Mandas and today our group is going to be presenting the Community Windshield Survey of Signal Hill. Signal Hill is at the southwestern part of the city and it has 130,000 populations as per the city of Calgary. For the physical environment, Signal Hill is an affluent community and as I drove through the neighborhood, I observed the community's well-maintained public spaces, and the community is characterized by its cleanliness and well-maintained streets are clean, speedy bumps are provided for safety, infrastructure is in good repair, reflecting a high standard of upkeep. And for the housing structures, Signal Hill predominantly features low-density residential development, including large single-family homes, townhouses, and apartment complexes. According to the City of Calgary Community Profile, 97% of the households are in good condition. Residents have access to numerous parks and green areas such as Battalion Park, known for its historical significance, and a 20-kilometer of paved walking and biking trails. These spaces are well maintained, providing residents with opportunities for outdoor activities and leisure. So in summertime, you can see people that are walking, biking, running, and doing yoga at the park. So for the environmental hazards, according to the residents, the high elevation of Upper Signal Hill results in strong and excessive winds causing flying debris. A slippery road on the higher areas during winter is also a concern. And additionally, soil erosions in elevated areas can increase the risk of flooding in lower areas. So as you can see in the pictures, the houses are all well maintained, and also the public spaces and the green spaces as well. So in Signal Hill, there are commercial establishments like groceries, banks, retail stores, restaurants, and services in Signal Hill community. These commercial establishments are contributing to the community's socio-economic status. For the income disparities, according to the City of Calgary, residents have median household income of $116,000, which is higher than Calgary's average as per the City of Calgary. So Upper Signal Hill is home to residents with median household incomes ranging from $200,000 to $400,000. So the residents living on the Upper Signal Hill are earning more compared to those at the lower area. So as you can see on the graph, people are earning more than the Calgary's average. And for the geographic disparities, Upper Signal Hill offers magnificent panoramic views of the city and the Rockies, driving up home values and making the homes only affordable to high-income residents. While in Lower Signal Hill has more affordable homes, but they faces higher traffic and noise pollution. So the Lower Signal Hill residents have better access to shopping centers and transit, while those in upper areas rely more on private vehicles. As for the basic amenities access, residents enjoy convenient access to essential services including grocery stores, pharmacies, schools, and community centers. The community has the Signal Hill Public Library, which serves and provides educational resources and programs, especially for the children. And the proximity of these amenities enhances the quality of life and commitment to providing comprehensive services to its residents. So, given the community's affluence, what do you think could be a potential issue? So let us explore more. Thank you.
Hi, it's Farhana. Thank you, Marika. I will be presenting transportation. So, as we can see, Signal Hill is a well-developed community with comprehensive transportation infrastructures, and this community has well-maintained arterial roads, including Cersei Trail to the east, 17th Avenue North, Stony Trail South, and 69th Street on the west. So all the major and minor streets have continuous sidewalks with accessibility ramp. Some major roads have speedy bumps for safety reason, and crosswalks. Most of the residential streets have marked crosswalks, and also the designated crosswalks with signage present in the key intersections. And also there are, according to the city of the Calgary, 78% people have private car, truck, and van, and 8% people use public transportation for public transportation. Yeah, so there are several routes served by the Calgary Transit. Among those, 93 and 94 are important, significant, I can say, and the service can be available every 20 to 25 minutes, and these services connect the community with the 69th Street Southwest C train station. And the C train, this service is available every 3 to 10 minutes, and you can see the bus stops are placed strategically throughout the community with special consideration to various essential services like grocery store, shopping centers, health care facilities, and recreation center, etc. So what we can see, our residents have reasonable access to the essential service using public transport, but however during off-peak hour it can be hard for the residents to get access to work or medical appointment, especially for those who rely on public transportation. As Signal Hill is located too close to C train station, the long commute is rapid and efficient. By building more shelter and accessibility friendly stops, the community can improve transit access for the seniors and people with mobility challenges. Thank you.
Thank you, Farhana. Hello, my name is Raj Chaudhary, and now I will be presenting the healthcare facilities near the Signal Hill community. So first one I will be talking about is the Rocky View Medical Clinic, which is a primary care service clinic offering checkups, immunization, screening, chronic disease management, and it's located within Superstore building with ample parking and there is many positive reviews for the staff professionalism. Next one is the Rocky View General Hospital, which is a 650-bed hospital providing 24/7 emergency care, eye treatments, orthopedic surgeries, dialysis, and senior health programs, and it is continuing to expand for improvement in patient care. Third one is the Signature Medical Center, which offers family and pediatric care, immunization, routine checkups, and located in Signature Park and provides walk-in service in an online appointment booking. Next one is the Revolution Remedy Pharmacy, which is a local pharmacy offering prescription medication reviews, COVID-19 testing, and digital communication tools for patient support. And last one is the Careway Signal Point, which is a long-term facility specializing in rehabilitation and senior health services, and promotes independence and social engagement while providing specialized care for complex health needs. Next one is the proximity to the residential areas and accessibility for the public transit or other means of transportation. So all the services that are provided are near the Signal Hill community and are accessible by bus, sea train, or car. Public transit ensures timely travel, and parking is available at all locations including street, public, and paid parking spots such as Rocky View Hospital. Thank you very much.
Hi, my name is Ali. I'm going to represent recreation space. Recreation space in Signal Hill. Recreation space in a Signal Hill playground and sports field that encourage community engagement and physical activity. The facilities are essential for social activity, physical exercise, and family event. So Signal Hill Recreation Facility 2024. Baltillion Park. This park known for historical geography and offer walking paths, boardwalk, wooden staircase equipped with a bicycle ramp and lookout the point. The park is well maintained with clean pathway and clear signage detailing the historical significance. Playground. Within the Signal Hill community, there are several playgrounds equipped with modern play structure. This area are regularly inspected for safety, and amenities such as bench and trash receptacle are available. Sports field. Signal Hill provide access to sports fields suitable for soccer and baseball. These fields are maintained to ensure safe playing conditions, with well-kept grass and clear marked boundary. West Side Recreation Center, situated near Signal Hill. This facility offers variety amenities, including aquatic gymnasium, fitness area, ice arena, climb wall, skate park, and the child mining service. It's designed to cater to diverse recreation needs for all age groups. Condition and maintenance. The recreation space in Signal Hill are generally well-maintained park and playground are kept clean, with a regular upkeeping ensuring the safety and enjoyment of the visitor. Community activity. This space frequently hosts community gathering and recreation activity. It's common to see local sports teams practice in the field, family enjoy time in the park, and various events organized by community association. Bulletin boards in this area are often display information about upcoming events and programs, indicate active community engagement. Thank you.
Hello, my name is Irina. I'm going to be presenting the social determinants of health for this windshield. Signal Hill community is a well-established community in Calgary known for its strong social cohesion and supportive environment. The community provides a diverse range of educational institutions, recreational facilities, and healthcare services, contributing to positive health outcome. This windshield survey highlights key aspects of the neighborhood, including education, community programs, safety initiatives, socioeconomic factors that impacts residents' well-being. One of the social determinants of health in the Signal Hill community is income and employment. The community has a lot of job opportunities in retail and professional services. The house and retail cost may be on the higher end price. The employment rate is at 53%, and the unemployment rate stands at 12%. That is a statistic by City of Calgary. Education and literacy, Signal Hill offers a variety of public schools, more oriented schools like boys only schools, science focused programs, and Montessori schools, childhood experiences in the community events, annual neighborhood cleanup, and Easter egg hunt that is organized by the Signal Hill Association community, recreational facility that supports child development and well-being. Physical environment is Signal Hill. It's a safe neighborhood with a minimal crime, vandalism, and unhoused people. Access to public spaces and parks. Calgary Police also have a program set for the community, which is named Calgary Police Services 9 p.m. routine, where property owners are supposed to check their windows and doors and the surround property. Social supports and coping skills, community centers and libraries. They offer various programs for all the age groups. Social isolation among 65 plus age groups remains a concern within the facility. The healthy behaviors is healthy promoting facility like West Side Recreational Centers and Library, accessible healthcare services, access to health services. As it was mentioned earlier, Signal Hill offers accessible healthcare services. The community health nurse can work with the local stakeholders to develop inclusive health programs. Biology and genetic community resources help mitigate potential health risks. Gender health initiatives in Signal Hill should be inclusive population, which stands at 6,000 plus men, 6,210 men and 6,795 women. Race and racism, because of the diverse population, social cohesion, community, with ongoing efforts needed to ensure inclusion for all culture and racial groups. What do you think is the most developed social determinants of health in the community of Signal Hill? As per my own findings, I think the socio-economic status is well developed and established. The infrastructure, the access to education, recreational center, and the high-cost property. What is the least developed social determinants of health in the Signal Hill community? The social inclusion and accessibility for seniors, the aging population, and is being overlooked. Analyze and reflect. Interpret findings. Signal Hill is an affluent, well-established community with a strong engagement, quality infrastructure, accessible healthcare, recreational spaces, excellent schools, and low crime rate. However, challenges include an aging population and chronic disease that comes with aging, social isolation among seniors, chronic disease management, and theft concerns. Our recommendations as a group is expand senior-friendly programs to reduce isolation through community activities, volunteer opportunities, and fitness groups. Enhance home care services for Alzheimer's and chronic disease management to support aging in place and reduce hospital reliance and cost. Strengthen the mental health resources, especially for seniors and professionals. Improve neighborhood watch program to prevent break-ins and theft. Reflective insight. Signal Hill is a beautiful, safe, and welcoming community. Exploring the park's history and admiring the luxury homes was highlighted. This experience reinforced the impact of aging, demographic, chronic disease, mental health, and community safety on a well-being. Signal Hill supports its residents' health, making it a desirable place to live. Implication will be aging population needs. Nurses should promote fall prevention, chronic disease management, and social engagement to improve seniors' quality of life. Expanding home care services and senior support programs can enhance independence. Preventative health care, encouraging immunization campaign and screening for cardiovascular disease, diabetes, and mental health disorder to prevent illnesses and promote early detection. Healthcare access, mobile health services, and improved public transportation can enhance access to medical facility, clinics, and hospitals. Mental health and social well-being. Social isolation among seniors increase the risk of depression and anxiety. Screening, psychological care integration, peer support groups, and caregiver education can provide essential support. Community safety and public spaces, improve pedestrian infrastructure for wheelchair users, and implement winter safety measures to prevent falls, particularly among seniors. Standard of practice in community health nurse, as a chronic disease related to aging are a significant issue in the Signal Hill community. One of the community health nurse standard of practice that a community health nurse can apply is prevention and health promotion. This standards enables the nurses to implement preventative and protective approach, such as identifying at-risk population through screening, recognizing risk factor, promoting immunization, and educating residents on preventative health measures, including nutrition, physical activities, and chronic disease management to help maintain their health and independence. As a future licensed practical nurse, this knowledge will help us assess health barriers for vulnerable population, identify community strength, set priorities, implement interventions, and evaluate outcomes to improve community health. As a future community health nurse will be able to identify health disparities, promoting health equities, engagement with local stakeholders, and improving older age overall.